Hi guys, Dr. Mary here again, and I am so excited about our guest today. She is amazing. She is a fellow pediatrician. Her name is Dr. Hokehi Eko, and I'm going to let her introduce herself.
Okay, thank you so much, Dr. Mary, for having me on. Such an honor. Yes, like she said, I'm Hokehi Eko, pediatrician, mommy of three, and I run Glow Pediatrics. And what's Glow Pediatrics? So we're a practice dedicated to shortening the gap and shortening the time it takes to get diagnosed with autism. Because right now in the United States, in most states, there is at least a 2-year wait time for children to get diagnosed. And why is that such a problem? It's because the earlier a child gets intervention, meaning the earlier the child gets a diagnosis, the earlier we can get services in place, meaning therapies. If the child needs speech, if the child needs occupational therapy, if the child needs applied behavior therapy, we can get resources around that child sooner than later. And because the first 5 years of life is so critical to anything we're doing, right? Which is why we are spreading this message about how important it is for us to get our children the help that they need. Not because we're trying to label your child, because your child is more than a diagnosis. Your child is your precious child. That doesn't change in any way. But your child also needs support, especially in the school system. And so it's critical for parents, as hard as it is, to just do the right thing, which is getting your child evaluated
Mhm.
and getting them the help that they need. And so we're here to bridge that gap. So
So, say that again, Dr. Echo, that
which
you're
part?
why is getting an early diagnosis so important?
Yes. An early diagnosis is so critical because first 5 years of life is when brain growth is at its highest level, right? Your child's brain is rapidly growing. So if we're going to make any changes and any differences in the right direction for your child, we need to do it within those first 5 years, if possible. It's not that it can't be done after that, but then it gets harder.
Mm-hmm.
So that's the way the brain is set up. So much research around that. That's why you hear the words early intervention, early intervention. And again, I always want to stress for parents that say, I don't want my child labeled. This is not about labeling your child. It's about getting the help and support your child needs. Because unfortunately, the way it's set up, the school system is, your child won't get the support they need, meaning they won't get accommodations if they need to be in a smaller classroom. They won't get the help they need for testing. They won't get the extra services. In some states,
Mm-hmm.
they may not even be able to get speech therapy, occupational therapy that they need, they desperately need. So your child is actually suffering
Mm-hmm.
because they don't have a diagnosis. And yes, there's such a backlog of um and such a wait list for getting the diagnosis. And that's why I really started Glow Pediatrics. It's like, hey, I can help with this. Our children don't have to suffer. Our children shouldn't be waiting years and years and years to get the help they need, because
Mm-hmm.
that's not right. And
Yep.
so
Diagnosis is a key that unlocks the
I
help your child needs.
like that. I'm gonna have to copy that one. Diagnosis is the key that unlocks the resources your child needs. Absolutely. That's all it is.
That's
Don't
all
change
it is.
anything about your child, because your child that you see today is not going to be the same you see next year,
Yep.
regardless of the diagnosis.
Mm-hmm. Mm-hmm. And so and especially in the Black community, which is, I hone in on that.
Right.
We look at it as a label. We look at it as another strike against us. We look at it as another hurdle that our child is going to have to overcome, because people are going to look at them and see that. And so there is a hesitancy to seek out that diagnosis in especially the Black community. Would you agree to that, Dr. Echo?
Absolutely, yes. And even I go so much as to say the African community, because
Mhm,
I'm originally from
mhm,
Nigeria. And so
mhm.
same story. It's like,
Same.
no, we're not, no, like that's not even a thing. They rather hide the child than we have a conversation about a diagnosis. And it's really unfortunate because the thing is, we want the parents to understand this does not mean your child is less than in any way, shape, or form. We're just
Yeah.
trying to get your child the help they need. And the thing is, children get reevaluated every few years.
Mhm.
And at some point, some children are completely off. I mean, they no longer meet the criteria for being considered autism. I've seen that. And I'm
Mhm.
not saying that's the case for everybody, but the point is the sooner your child gets the help they need, the better they become, and the better and the more likely they're going to thrive in every area of their life, because our goal really is your child, where they are, they thrive, right?
Mhm.
Our goal is
Mhm.
not to make them into something they are not. We're
Mhm.
not talking about curing anything. We're
Yes.
talking about how can we optimize where your child is? How can we optimize their brain health?
Mhm.
That's the part I like to talk about. How can we
Yep.
optimize their learning? How can we optimize the therapies that they receive so that overall your child is the best version of themselves? That's it.
Mhm.
So
And
it
talk
doesn't,
about, I'm sorry, talk about sort of your training and how you are equipped to do this, even above and beyond just being a pediatrician.
yes. And so I like to call it a God moment, because it's not like I didn't know that children wait 2 years. I'm in Oklahoma, so it's not like I didn't know it. I kind of knew it somewhere in the back of my head as a
Mhm.
general pediatrician, but I had this, it like just came to the fore of my mind, like, wait, there's something I can do about that, right? And so I went to get the additional training. I was mentored by a behavioral pediatrician, and
Mhm.
so I got the training I needed to be able to do the clinical diagnosis for autism and for ADHD, above what we received in residency, because we're
Mhm.
not per se trained in all the
Exactly.
aspects of diagnosing it. So that's
Mhm.
what I did. And I was like, oh, I can start helping people. So let's get this wait list down. And so
Mhm.
that's where I started. And I started Glow. And I was like, okay, I'm just gonna help. And then I started helping. And then I was like, but what? Wait, I can do some more stuff with them,
Mhm. Mhm.
because I also around this time. So what happened was my daughter, she was about 9 at the time. Her lips turned jet black, like
Mhm.
as dark as, so she went from pink lips to black lips. And I said, what in the world? And I went to the allergist, I went to the dermatologist, and nobody could figure out what the issue was. And so not only were her lips black, but then she started having all the skin reactions, her behavior started changing, and she
Mhm.
was struggling. And I was like at a loss, like, come on. She
What
looks like
is
she
this?
has allergies, but her allergy tests were all negative. So what in the world is going on? And so I started searching, and I started asking people on Facebook, I mean, other pediatricians, like, do they know what this is? And I
Mhm.
came across this test that was a food sensitivity test I could do at home. I did it. Oh my gosh. My daughter was highly sensitive to gluten, dairy, egg,
Wow.
cashew, pineapple. I said, what? So
Everything she was eating, probably.
that, and I was like, the queen of whole wheat bread. I was like,
But you didn't know.
I didn't know. So, being who I am, I just cleared the fridge that day when I got the result. Everybody in the house became egg-free, dairy-free,
Yep.
all at one
It's
go.
all got to
I
go.
don't really recommend it, but that's what I did.
Mhm.
So I cleared out her food. I I cleaned up our diet, and 6 weeks later, about her lips started turning back to pink, and I was like, "Oh, hold on a second." So
Wow.
there's such a connection between food, behavior, uh,
Mhm.
all of this. I had no idea before then. And so that's what led me to going back to get retrained in integrative medicine. And all integrate, that big word, all that means is we look at the root causes of what's going on with the child. So instead of medicating with steroids and all,
Mhm.
skin changes. I'm like,
Mhm.
what exactly is going on? So we are
Mhm.
looking at what she's eating, things like that. So basically, it's a combination of conventional medicine
Mhm.
and evidence-based complementary medicine. So we're looking of from best of both worlds, like what exactly can we change, right? And what can we use? So therefore, the first goal isn't the medications, and I'm not
Yeah.
against meds. I prescribe meds, But that's not the first. The first thing is let's look at the environment, let's look at what they're eating, let's look at sleep, let's look at all the things that affect the child to see
Mhm.
what is going on and what we can change. So I got that training, and then I was like, oh, I can help the kids. So I started helping the kids after the diagnosis. Like,
Yeah.
okay, 95% of my patients are constipated, don't sleep well, don't eat well,
Mhm.
are aggressive, plus or
Mhm.
minus. So I started helping them with that from an integrative lens. And so that's how Glow Pediatrics has evolved.
Wow.
Yeah. So
That's amazing. That is amazing. So it's
yeah,
like a whole, you look at holistically the whole patient,
child.
whole
Mhm.
child. You from the inside out and the outside in, and
Yes.
you help them from lots of different angles with their diagnosis, whatever that diagnosis may be. And I know you're based in Oklahoma, but
Right.
it how are you, I know you're doing some virtual consultations. How does that work? I'm sure that the listeners are dying to know.
Yes. So of course I started in Oklahoma, and then I was like, oh, then I started getting calls like, oh, do you do this in other states? I was like, oh. So I
Mhm.
got other state licenses, and I figured out how to do it virtually, how to do a virtual evaluation. I found someone that does it. So I asked questions, I learned a little bit from them, and I started doing the virtual evaluations in other states. So
Mhm.
as we speak, we're in at least 8 states now. So
Okay.
Oklahoma, Texas, Minnesota, New Jersey, New York, Pennsylvania, Florida, what else? Georgia, Maryland, so 9 states. And
Awesome.
adding more as we go because it's across the board. I mean, I talked to a patient the other day who has been waiting for 5 years for an
Wow.
evaluation. And I said, how is that possible?
How is that possible?
And their child
Five
is getting
years.
no help and just keeps getting passed on to the next grade, and really they don't have any therapies on board, nothing. And I'm like, how is this even happening? So
Wow.
that's what drives me to just be the help that I can be to help shorten this gap that
Yeah.
we have. Yeah.
Yeah, that is so sad. Like, and the fact that you know, you said it was a God moment, and then so you started with an idea, and then you built your training around that to be able to do what you do. And that just goes to show like what being motivated can bring about. And you started, probably where did you start, like only inpatient or in person, and then how did that evolve?
Yes. So I started only in person, and then when I started getting asked from all, I started getting calls from other states, and I knew obviously I can't go to all the states, and all can't come to me. So that's
Yeah.
when the virtual piece started as well.
Wow.
Yeah.
That is amazing. So if there's other clinicians listening and you're hearing Dr. Echo and you're like, I'm experiencing that same gap where I am, look at what you can do.
Yes.
Yep, that's amazing. So fast forward, you've started, your daughter's doing better.
Yes.
You started Glow. You are now sort of expanding out to other states. Um, what else do you see in the future that you can do with this? Have you thought of that? I know you're having a virtual summit that's coming up in, I think you said August 19th.
Yes.
And so
Yes.
so just kind of talk about some of the other pieces that you're kind of putting into this equation as you grow and expand.
Yes, thank you. So after we do the evaluation, so the next thing I started hearing was we can't get into speech, we can't get into OT, we can't
Mm,
get into ABA. Now
mm,
months wait list again. So I started getting feedback from the parents like, okay, so what are we supposed to do?
mm,
So I did start a group program in my practice. So like my patients, I would meet with them once a week at lunchtime. I'm like, okay, what questions do you need answered? So maybe one week would be We'll talk about constipation. So how can we
Mhm.
deal with constipation from an integrative standpoint? And then I was like, oh, well, I can't possibly do everything because I
Yeah.
don't know everything. So I
Yeah.
found a lady, she's my dear friend who does, she helps children with executive function skills, and she's she's a PhD in education. So I
Okay.
had to come in and start talking to the parents about executive function skills. And so that went really well. And the parents were like, oh, this is great. So I was like, oh, so what else can we do to
Yeah.
broaden this? Because it's like they're waiting. And so we can do something. So Glow is, we're launching this new part of our practice where we're gonna have ABA, speech, OT therapists come start working with the parents virtually
Mm,
while they wait before they go to in-person therapy. So
wow.
really is teaching the parents what they can do with their kids at home. Because research experience shows that once if a parent is doing the same thing that the therapist is doing, I mean to whatever degree that is at home, the children
Hmm.
do better because
Hmm.
they're experiencing the same thing. So it's not like you go to therapy for 20 minutes every 2 weeks or whatever it is, because that too is an unfortunate reality. And then that's it for the next 2 weeks. Nobody's
Nothing.
doing any follow up at home. Nobody knows what to do because they just sometimes they don't even let the parents in the therapy, right?
Mhm.
Because whatever the reason is. So I was like, this will help the parents. At least they start knowing what to do with their kids for themselves at home.
Mhm.
When the kids eventually get into in-person therapy, then that they have a leg up, right? And they can they know how to interact with the therapist in person, they know what to ask for and all of that. So it's basically trying to empower parents. And then we're gonna have nutrition classes as well,
Mhm.
because a big part of helping our children with autism and ADHD feel better, do better is their nutrition.
Mhm.
Because you are what you eat,
Mhm.
essentially. And the gut and the brain are connected. So anything you put in your mouth is going to your brain. And
Yep.
autism and ADHD are brain-based. So it makes sense that you should want to work
Wa-
on what they are eating if
mhm.
you want to see a difference in how they behave.
Absolutely.
Yeah,
Hmm.
I have seen, for example, I have seen kids who are so constipated and they get more aggressive. I mean, I asked direct
Hmm.
to the parents, is your child more aggressive when they're constipated? The answer is yes.
Yes.
Okay, so that means we need to clear them out, and it's not enough to just do Miralax. That's cleaning out. We need to
Hmm.
heal the guts too, because being constipated is not the way the body was made. The
No.
body was made to release all of those things. And so it creates a backlog. Plus, it's actually toxic to the gut and to the brain as well, because again,
Hmm.
they're connected. So if we work on things like that, then it helps the child thrive overall. And so you'd be amazed how not being constipated contributes to
I
being
mean,
aggressive.
if I'm
But actually
constipated, I'm
learn.
aggressive.
I
Like,
know.
I mean, you don't feel good. Like, that's
No.
just logical.
I
Yeah.
know. And then they don't sleep well because their tummies are on fire and they can't
Yep.
even tell you why, what
Why?
the reason is.
Yeah. Yeah.
So yeah. So yeah, I think that that's really, so that's what we are trying to accomplish here is like, again, as much as possible, create a holistic solution so parents can be empowered. That's really our goal, is to empower parents in the big areas. And of course, we are talking with Dr. Mary about her amazing parent coaching.
Oh
So
gosh. Yes.
yes, to come in there and from that angle to help support the parents, because it's all hands on deck that we
Yeah.
need, whatever it
All
takes,
hands
right?
on deck. And
Yeah,
it's serious, and seriously, whatever I can do to help, I'm happy to do it because it's all hands on deck at this point.
yeah,
And I think that, and you'll tell me if you agree with this, Dr. Echo, that, we got better at diagnosing autism,
hmm,
and we did not shore up the skills to treat and to help with autism at the same rate. And so that is why I think we're experiencing the severe shortage in people that are able to not only diagnose but also treat, like ABA therapists, whether you agree with that or not, like occupational speech, people that specialize in autism because, yes, there's occupational therapists, there's speech therapists, there are ABA therapists, but autism is a different animal. And so
Right.
there are not enough people who are familiar and specialize in treating this population. And even ADHD too. Like
Yeah.
again, autism and ADHD have a very similar
Right.
you know, in within the executive functioning challenges, the emotional dysregulation, there can be sensory issues in both of them. And
Right.
so there are just not enough, people around to help.
Yes, absolutely. So that's why if we do it virtually, then we can serve more people, even if it's a few people, until we replicate ourselves enough.
Mhm.
That way we can help many more people in that way. Yes.
Mhm. Mhm. And I love your story just because, it's not like you had this master plan and you went out and you did all you listened to the needs of your patients and
Right.
you built what they needed. You're building as you go along. You're
Yes.
building the plane as you're flying it.
Right.
And so some of us like
Literally.
get it's like you're like, let me put that propeller right there. Let me, because like, oops, we're dipping down. I better put another wing, and it's like you're listening and you're not afraid to go out and get if you can't provide it, you're not afraid to go out and get what people are telling you that they need to help their families thrive, help their loved one thrive, and I just admire that so much, and I think it's amazing.
Thank you. Thank you. Thank you.
Seriously.
And thank you for wonderful friends and colleagues like you who help the plane to keep flying.
Yeah. All hands on deck.
Right.
All hands on deck. It
Literally.
takes all of us, and and I love it that because like it or not, people like to see people like them and that builds trust. And so, I'm passionate about the Black community. You're a African lady, I'm an African American lady, and we are living it and normalizing it every day. And we
Right.
have people that are, I look at it like they're counting on us. Like if they didn't see us, if they didn't see themselves in us, they would delay seeking that care even longer,
Right.
because it's daunting to go in to an office and to a where there's nobody that looks like you. There's nobody that understands you culturally. There's nobody that understands like why you didn't think that this thing was abnormal for this long or not typical for
Right.
this long. And it's like but in my culture, that is not against the norm. Or well, we don't take our kids or loved ones to the doctor for anything other than like medical problems. And
Right.
so, I think us saying no, like, come, like, let us help
Yes.
you. We
Right.
understand. It's amazing. And then you have another physician working with you, and I believe she's a Latina, and
Yes.
the same the
Mhm.
same stigmas exist there. And so just
Right.
bringing in having someone that can serve whoever may come
Right.
is amazing.
Yes, yes. And I was so humbled a couple weeks ago. Mommy drove 5.5 hours to my
Wow.
office, and I said, wow.
Wow.
Because I was trying to say, oh no, I can find someone in your state. She's like, no, 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 I'm coming. And I was
I'm
like,
coming to you.
oh my goodness
Mhm.
gracious. Okay,
I
so
know you get me.
so
Mhm.
those are the things that keep me going on the days when I'm like, what's up with the plane?
Yeah. What's can't keep it flying today. I can't fly anymore today.
I know. Yes. So
Well, I mean, I can't tell you enough like how much I'm rooting for you. I admire you. Keep going. Whatever I can do to help, I certainly will. And you're gonna have to come back again and again and again. So
of course.
so because we just vibe too, like
Yes,
we get each
totally.
other. So, but I want to just say thank you so much for coming on. Tell
Sure.
our listeners where they can find you.
Okay. Yes, and absolutely my honor and pleasure to be here, of course, with my new friend. So, yes, so I'm on, let's see, my website is glowpediatrics.com. So glow is GLOW, not GLO, GLOW pediatrics.com. I'm on Instagram at Glow Pediatrics, also at my name, Dr. Hokehi Eko, on LinkedIn at my name, on Facebook as my name, and Glow
Okay.
Pediatrics. And we have a YouTube channel called Brain Power with Dr. Echo, as well as a
Okay.
podcast with the same name, Brain Power with Dr. Echo, anywhere you can listen to podcasts. And what else? Oh, I have a TEDx talk on ADHD. That's an
Okay.
interesting listen if you would like to listen. So if you just Google Dr. Echo TEDx, it should come up.
Okay.
Yes.
Awesome. And we'll put this in the show notes. So we'll get links to everything and we'll put it in the show notes to make it easier for you listeners to access it.
Okay. Oh, and I always forget my book. I have a book called
Look, she just does I just wrote a book too. That's all.
Oh, Lordy, too many things to remember. Let's see. It's called Children's Love Letters, a pediatrician's guide to how your child spells love, because our children
Oh,
spell love in so many different ways. And so it goes back to what Dr. Mary said. I think she said it in this one, or maybe it's in my recording with her, where she said it's so important for us to understand and know our kids, because
mhm,
in that's the best way for us to provide the help that they and the care
mhm,
that they need. So,
mhm.
so yes, there's that too. It's on Amazon on my website. That's it.
Awesome. So we'll put a link to that too. Dr. Echo is going to have to send me all these links, but we'll put it all in the show notes just to make it super easy for anyone who wants to reach out, needs to reach out to contact her. And they're in 8 or 9 states now. Can you repeat the states again, just so people will know?
Okay, so it's Oklahoma, Florida, Minnesota, Maryland, Georgia, New York, New Jersey, Pennsylvania, and Florida.
Okay. And how do they contact you if they're in one of those states?
So, great question. You can either go to our website, glowpediatrics.com. We have a short contact form. You just fill that out, we'll call you. Or our office number you can call is 405-871-5807, and we'll schedule you. Or if you have questions, we'll answer them, whatever the case is. So, yeah.
And what's the wait time?
So the wait time is our promise is we try to do it within 2 weeks. So
Wow.
that's the wait time.
Guys, that is amazing.
Yes,
And people wait 5 years. You just heard Dr. Echo say that. You can get an evaluation for autism. And do you do ADHD too?
as well. Yes,
ADHD and autism evals in 2 weeks. That is amazing.
yes.
Wow. Thank you so much for everything that you're doing.
Thank you. It's my pleasure. Yeah.
All right. Thank you guys. And we'll see you in the next one. Thank you, Dr. Echo.
Thank you for having me.